Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Children's Communication Checklist evaluates various aspects of communication in children. It assesses structural language, including syntax and semantics, as well as pragmatic language skills, which involve the social use of language. The tool identifies difficulties related to developmental language disorders, autism spectrum disorder, and other communication impairments. Its main purpose is to provide a comprehensive profile of a child's communicative abilities to aid in differential diagnosis and inform intervention planning. The checklist assists clinicians in distinguishing between language delays and social communication deficits. The Children's Communication Checklist is indicated for children aged 4 to 16 years presenting with suspected pragmatic language impairment or other communication difficulties not attributable to intellectual disability or autism spectrum disorder alone. It is particularly useful in differentiating pragmatic language deficits from structural language impairments and in identifying communication profiles in children with developmental language disorders, social communication disorder, and high-functioning autism. The tool is most effective in clinical and educational settings, where detailed assessment of social communication, speech, and language skills is required to guide intervention planning. Its standardized nature allows for comparison with normative data, enhancing diagnostic accuracy in populations with complex communication needs. The Children's Communication Checklist, 2nd edition, consists of 70 items designed to assess communication skills in children aged 4 to 16 years. The checklist includes questions addressing speech, syntax, semantics, coherence, initiation, scripted language, context, and nonverbal communication. Each item is rated on a 4-point Likert scale indicating frequency of behavior: never, sometimes, frequently, or always. The questionnaire is typically completed by a parent or primary caregiver familiar with the child's communication patterns. After administration, raw scores are summed across 10 subscales corresponding to distinct communication domains. These raw scores are converted into standard scores based on normative data referenced by age. Scores below 85 suggest typical communication skills. Scores between 71 and 84 may indicate mild communication difficulties, and scores below 70 indicate clinically significant impairment. The General Communication Composite Score synthesizes subscale results to provide an overall measure. Elevated scores in specific subscales guide targeted assessment and intervention planning. Interpretation requires consideration of the child's age, developmental profile, and cultural background to ensure accurate clinical judgment. The Children's Communication Checklist, 2nd edition, demonstrates a sensitivity ranging from 0.8 to 0.9 in identifying children with pragmatic language impairments. Sensitivity reflects the test's ability to correctly identify those with the disorder. Thus, a sensitivity of 0.9 means that 90% of affected children are accurately detected by the checklist. Specificity for the tool typically ranges from 0.7 to 0.85, indicating the proportion of children without the impairment who are correctly classified as unaffected. For instance, a specificity of 0.8 implies that 80% of children without communication difficulties are correctly screened out, minimizing false positives. These metrics show that the checklist is reliable in detecting pragmatic language issues while maintaining reasonable accuracy in excluding unaffected individuals, supporting its utility in clinical assessment. The Children's Communication Checklist, second edition, was developed by Dorothy Bishop and colleagues in the late 1990s to address the need for a standardized tool that accurately identifies communication difficulties in children, particularly those associated with pragmatic language impairments. Validation studies conducted during its development demonstrated satisfactory internal consistency, with Cronbach's alpha coefficients exceeding 0.9 for core subscales. Subsequent research has confirmed its reliability and validity across diverse populations, including children with autism spectrum disorder, specific language impairment, and social communication disorder. Factor analyses consistently reveal a stable two-factor structure separating structural language and pragmatic abilities, supporting the theoretical framework of the checklist. Normative data obtained from samples exceeding 1,000 children in the United Kingdom and other countries provide robust reference points for clinical interpretation. Moreover, correlations between the checklist scores and other established language and social communication assessments reinforce its convergent validity. Longitudinal studies indicate that the Children's Communication Checklist, second edition, can effectively track changes in communicative abilities over time, further substantiating its utility in both research and clinical settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.